improving the health of Arkansas and changing the way healthcare is delivered by responding to the community's health needs. Welcome to Comcast Newsmakers. I'm Stephanie Bryant, coming to you from the state capitol. And joining me now is Russell D. Harrington, Jr., the president and CEO of Baptist Health. Thanks so much for joining me.
Glad to be here, Stephanie. Thank you.
Well, describe Baptist Health.
Well, Baptist Health is a faith-based, not-for-profit, locally owned and managed healthcare network of 8 hospitals, 50-some clinics, 17 outpatient therapy centers. In fact, we say we have 175 points of access across the state of Arkansas.
That's great. And talk about Baptist Health's strategic plan for the future.
Well, we're always planning for the future. It seems like a daily process for us, but the big thing that we have, our long-term vision for the future, is to improve the health of all Arkansans. And we recognize that that's a lofty goal, it's a lengthy time frame, and we realize that we can't do that alone. But working cooperatively with other institutions, partnerships, collaboratives, we really believe that we can improve the health of Arkansas.
That's great. And the hospital has a new vision statement. What is that and why is it so important?
Well, that's basically what I just described. Our vision statement is to improve the health of Arkansas by doing it through delivering healthcare differently than we have in the past.
And why do you think that is so important to people?
Well, as you know, in our state, we need to improve the health of all Arkansans, and so we're going to be trying to do that through this vision statement. There are lots of ways to do it. We're moving from inpatient to outpatient. We have 3 surgery centers. We have outpatient imaging centers. But we're also trying to take healthcare out to the people rather than expect them to always come to us. One way we're doing that is our new electronic intensive care unit. With that unit, remotely from our central core here in Little Rock, we're able to monitor critical care patients all across the state.
That's great. And of course that goes in how you guys are changing the way you deliver.
That's exactly right. That's how we're changing.
And I think that's important because that's accessibility, making it accessible for all Arkansans.
Well, we're a rural state, and it's not always easy for people from the far corners of the state to come in for their health care. So we're going to try to take it to them. In fact, today our electronic ICU is in 20 hospitals in our state, and 1 in Missouri.
That's
one
great.
At Fort Leonard Wood, Missouri.
That is great. And one thing about Baptist Health, you've been a leader in patient satisfaction. Talk about that.
Well, you have nothing unless you have satisfied patients. That's the best source of public relations. When patients come to us, we want them as they leave, if they have other healthcare issues, to come back to us. So we really have worked with all of our employees to strive to make them understand the importance of our patients. They're our most important client.
Okay. And when we talk about importance, talk about your important focus, the capital campaign.
We've been in our current location at Baptist Health Medical Center Little Rock for 40 years now.
Oh.
Still a great facility. It's in the very best location in the central part of Arkansas at the apex of 2 interstates. But the hospital facility needs to be upgraded and needs to be expanded. And so that's what the capital campaign's all about.
All right, well, thank you so much. Today's Comcast Newsmakers guest was Russell D. Harrington, Jr., the president and CEO of Baptist Health.